Danny, I'd like to move to the other end of the life cycle, which is working with people who are elderly, who presumably through wear and tear and through illnesses, perhaps the aging process, will frequently have genuine disabling pain. Now, this is a different phase of the life cycle than we talked about with pediatrics. How do you feel about working with people who are old, bent, deteriorating?
Well, I would say the older I've got, actually, the more I can relate to that. You know, I think when I first started practicing, it was a very distant sort of patient in terms of experience. As one gets older, one also starts to associate more with that, and perhaps even made more anxious by that as well as a practitioner. The body is an amazing, or has an amazing ability to recover, even in the most degenerative of conditions. In other words, not all degenerative conditions on paper actually give symptoms. However, often when it's on paper, the patient can sometimes get worried by it. So often my role is to reassure them that it doesn't necessarily mean that they're going to suffer because they've got a degeneration of the neck, for example. So there is a very, as I say, a part of treatment which can help that side of things. But there's another side, and that is sometimes, I think, the realization by the elderly patient that they're going to have to live with this, and that there isn't anybody that can necessarily help their spinal stenosis to recover. So it's also, again, a difficult juggling act between helping the elderly patient realize that this is something that that isn't necessarily going to fully recover, and at the same time also be a practitioner that is able to help them. And you have to ask yourself the question, can you genuinely help this condition? Right.
But presumably you could help them emotionally.
You can help them emotionally. Sometimes perhaps not the realization that it is something that can't necessarily be 100% cured. In other words, stop fighting it. Stop trying to find a wonder cure for this. I think that's an important piece of information for them to understand. And also just care, like that somebody's going to care for them as an osteopath, that can help as well. Treating the tissues, and there is work that can be done often as well.
Right. So you don't write these patients off?
No. Much of our bread and butter is that age range anyway. But they've got a different prognosis than somebody who, say, for example, is in their 30s or 40s. Obviously.